5 Alzheimer tests you should avoid after 60. That may do more harm than good. Are you over 60 and wondering about those Alzheimer's tests everyone's talking about? What if I told you that some of the most commonly recommended tests might actually be doing more harm than good? In the next 20 minutes, I'm going to reveal 5 specific Alzheimer's tests that medical professionals are now questioning, and why avoiding them could be the smartest decision you make for your brain health. You'll discover the hidden risks that nobody talks about, the surprising alternatives that actually work better, and most importantly, how to protect yourself from unnecessary anxiety and potentially harmful procedures. But here's the catch. You need to watch until the very end, because the 5th test I reveal might shock you, and it's probably one your doctor has already recommended. Stay with me, because this information could change everything you thought you knew about Alzheimer's testing. Let me start by asking you something that might make you uncomfortable. When was the last time you questioned your doctor's recommendations? I know. We're taught to trust medical professionals completely, but what if I told you that when it comes to Alzheimer's testing after age 60, some of the most popular tests might be creating more problems than they solve? Have you ever wondered why some people seem to decline faster after getting certain test results? Or why your neighbor became depressed and anxious after a routine cognitive screening? The truth is, the landscape of Alzheimer's testing has become incredibly complex, and unfortunately, not all tests are created equal. Some can trigger unnecessary panic, lead to overdiagnosis, or even cause what we call the nocebo effect, where negative expectations actually worsen your condition. Think about it. Have you noticed how some people seem to give up on life after receiving certain test results, even when those results might not be entirely accurate? Let's dive into the first test you should seriously consider avoiding. The Mini Mental State Examination, or MMSE, has been around for decades and is still widely used by doctors everywhere. But here's what they don't tell you. This test was designed in the 1970s when our understanding of brain aging was completely different. Can you imagine using a computer from the 1970s to solve today's problems? That's essentially what we're doing with the MMSE. The test doesn't account for education levels, cultural differences, or normal age-related changes in processing speed. Have you ever felt rushed during a medical test and performed worse than you normally would? What's particularly troubling about the MMSE is how it can label perfectly healthy individuals as having cognitive impairment. The test includes questions like drawing a clock or remembering 3 words after a few minutes. But did you know that anxiety alone can cause someone to fail these simple tasks? And once you're labeled as having cognitive impairment, it can affect everything from your insurance rates to your family's perception of your capabilities. Have you ever considered how a single test score could change the way people treat you? The second test that's causing more harm than good is the routine use of amyloid PET scans for everyone over 60. Now, don't get me wrong. These scans can be valuable in specific situations, but the problem is they're being overused. Here's something that might surprise you. Did you know that up to 30% of cognitively normal adults have amyloid plaques in their brains? These are the same plaques associated with Alzheimer's disease, yet these individuals may never develop symptoms. So what happens when a healthy 65-year-old gets an amyloid PET scan and discovers they have plaques? Panic, depression, and a dramatic decrease in quality of life. That's what happens. I've seen countless individuals who received positive amyloid scans and immediately started viewing themselves as pre-Alzheimer's patients. They stopped making future plans, became withdrawn from social activities, and some even developed depression severe enough to actually impact their cognitive function. Isn't it ironic that a test meant to detect future problems can actually create immediate ones? Have you ever noticed how your performance suffers when you're constantly worried about failing? The third problematic test is the overuse of comprehensive neuropsychological batteries without proper context. These extensive test sessions can last anywhere from 4 to 8 hours and examine every aspect of cognitive function in minute detail. While these tests have their place in research and specific diagnostic situations, they're increasingly being used as routine screening tools for anyone expressing concern about memory. But here's the issue. These tests are so sensitive that they can detect minor variations in cognitive performance that have absolutely nothing to do with Alzheimer's disease. Think about taking a test when you're tired, stressed about a family situation, or dealing with medication side effects. Would you perform at your absolute best? Of course not, but these comprehensive batteries often don't account for these temporary factors. The result? You might receive a detailed report highlighting various cognitive weaknesses that sound terrifying, but are actually within normal limits for your age and circumstances. Have you ever received medical results that seemed scary until you got a second opinion? What's particularly concerning is how these detailed reports can create a phenomenon called medical student syndrome, where you start noticing every tiny memory lapse and attributing it to serious cognitive decline. Suddenly, forgetting where you put your keys becomes evidence of dementia rather than a normal part of aging. Do you remember how you felt the last time you Googled symptoms and convinced yourself you had a serious illness? The fourth test that's doing more harm than good is genetic testing for APOE4 without proper counseling and context. The APOE4 gene variant increases your risk for developing Alzheimer's disease. But here's what the marketing materials don't emphasize. Having this gene doesn't mean you will definitely develop the disease. In fact, many people with APOE4 never develop Alzheimer's, while some people without the gene variant do develop it. The relationship between genes and disease is incredibly complex, involving multiple factors including lifestyle, environment, and other genetic variations. But what happens when someone discovers they carry the APOE4 variant? Often, they experience what researchers call genetic discrimination, not just from insurance companies or employers, but from themselves. They start making life decisions based on fear rather than facts. I've met individuals who stopped pursuing new careers, avoided making long-term commitments, or even decided not to have children because of a genetic test result. Have you ever wondered if knowing certain information about your future health might actually make your life worse rather than better? The psychological impact of positive APOE4 testing can be devastating, especially when people don't understand that genes aren't destiny. Your lifestyle choices, social connections, physical activity, and mental stimulation all play crucial roles in brain health, often outweighing genetic predisposition. But when you're focused on a genetic time bomb, it becomes much harder to focus on the positive actions you can take. Doesn't it make more sense to focus on what you can control rather than worry about what you can't? Now, let's talk about the fifth and perhaps most surprising test that might be doing more harm than good: the routine cognitive screening that many doctors perform during annual checkups for patients over 60. You know the one I'm talking about. Those quick questions about the date, your address, and simple memory tasks. While these screenings seem harmless and even responsible, they can create significant problems when used inappropriately. The issue with routine cognitive screening is that it often lacks the proper context and follow-up that accurate testing requires. A busy primary care doctor might spend 5 minutes asking you to remember 3 words and count backward from 100. Then note possible cognitive impairment in your medical record based on your performance during those 5 minutes. But did they consider that you were anxious about being tested, that you had a poor night's sleep, that you were distracted by pain from your arthritis? Have you ever had a bad day that affected your mental sharpness? What's even more problematic is that these routine screenings often lead to a cascade of additional testing and referrals that may not be necessary. One slightly low score on a 5-minute screening can result in expensive specialist appointments, advanced imaging studies, and months of anxiety while waiting for results. And here's the kicker. Many of these follow-up tests confirm that there was never anything wrong in the first place. How would you feel if you spent months worrying about dementia only to discover the original screening was meaningless? But I'm not suggesting that all cognitive testing is bad or that you should avoid monitoring your brain health entirely. The key is understanding when testing is truly beneficial versus when it might cause more harm than good. The most important factor is whether the test results will actually change your treatment or improve your quality of life. If a test result won't lead to any specific intervention, or if the testing process itself causes significant stress and anxiety, then you need to seriously question whether it's worth pursuing. So what should you do instead? Focus on evidence-based approaches to maintaining brain health that don't require potentially harmful testing. Regular physical exercise has been shown to be one of the most powerful tools for preventing cognitive decline. We're talking about something as simple as a 30-minute walk most days of the week. Social engagement and maintaining strong relationships with family and friends provides crucial cognitive stimulation. Learning new skills, whether it's a musical instrument, a foreign language, or even technology, helps build cognitive reserve. Proper sleep hygiene is absolutely crucial for brain health, yet it's often overlooked in discussions about Alzheimer's prevention. Are you getting 7 to 8 hours of quality sleep each night? Managing stress through techniques like meditation, yoga, or even regular hobbies can significantly impact your cognitive function. And let's not forget about nutrition. A Mediterranean-style diet rich in vegetables, fruits, whole grains, and healthy fats has strong research support for brain health. The question you should be asking isn't, what test can tell me if I'll get Alzheimer's? But rather, what can I do today to give my brain the best possible chance of staying healthy? Have you considered that the time and energy you might spend worrying about test results could be better invested in activities that actually protect your brain? Here's something that might surprise you. Some of the most effective interventions for maintaining cognitive health are things you can start doing immediately without any testing at all. Managing your blood pressure, controlling diabetes if you have it, staying socially connected, challenging your mind with new experiences, and maintaining a sense of purpose and meaning in your life. These factors have more research support for preventing cognitive decline than many of the tests we've been discussing. But what about legitimate concerns? What if you're genuinely experiencing memory problems that interfere with your daily life? This is where the distinction between appropriate testing and unnecessary screening becomes crucial. If you're having difficulty managing your finances, getting lost in familiar places, or struggling with tasks you've always found easy, then targeted evaluation by a qualified specialist absolutely makes sense. The key word here is targeted. Testing that's designed to answer specific questions rather than fishing expeditions that might create more problems than they solve. When considering any cognitive test, ask yourself and your healthcare provider some important questions. Will the results change how I live my life in a positive way? Is there a specific treatment or intervention that depends on these test results? What are the potential psychological consequences of both positive and negative results? Are there less invasive ways to monitor my cognitive health? Have you ever wished you had asked more questions before agreeing to a medical test? It's also worth considering the concept of diagnostic momentum. Once you're labeled as having a particular condition, or being at risk for a condition, it becomes very difficult to remove that label from your medical record. This can affect everything from insurance coverage to how other healthcare providers view your symptoms. Sometimes the most courageous thing you can do is say no to unnecessary testing, especially when that testing might label you with a condition that may never actually affect your life. Let me share something that many people don't realize. Some of the most successful approaches to brain health focus on what researchers call cognitive reserve. This is essentially your brain's ability to maintain function, despite age-related changes or even disease processes. People with higher cognitive reserve can often maintain normal function even when brain scans show changes that might be concerning in someone else. And here's the beautiful part. Cognitive reserve can be built at any age through learning, social engagement, and challenging mental activities. The irony is that spending time worrying about test results and potential future cognitive decline can actually interfere with building this crucial cognitive reserve. When you're anxious and focused on potential problems, you're less likely to engage in the very activities that protect your brain. Have you noticed how worry and anxiety can make it harder to concentrate and remember things? This creates a vicious cycle where concern about cognitive decline actually contributes to temporary cognitive problems. Instead of focusing on what might go wrong, what if you redirected that energy toward what you can do right? Every day presents opportunities to strengthen your brain through meaningful activities, social connections, and new experiences. The goal isn't to achieve perfect cognitive function forever. That's unrealistic for anyone. The goal is to maintain the best possible quality of life while embracing the natural changes that come with aging. Think about the people you know who seem sharp and engaged well into their 80s and 90s. I'll bet they're not the ones constantly worrying about cognitive testing and Alzheimer's risk. They're usually the ones who stay curious, maintain strong relationships, continue learning new things, and approach life with optimism and humor. They focus on living fully in the present rather than worrying about potential future problems. Wouldn't you rather spend your energy following their example? This brings us to an important point about the medicalization of normal aging. Not every change in memory or thinking as we age represents a disease process. Just as your joints might be a little stiffer and your hair might be grayer, your brain also changes with age in ways that are completely normal. The problem comes when we pathologize these normal changes and create unnecessary anxiety about them. Have you ever stopped to consider that some memory changes might just be a normal part of getting older, rather than a sign of disease? The key is distinguishing between normal age-related changes and changes that genuinely interfere with your ability to live independently and safely. Forgetting where you put your glasses occasionally is normal. Forgetting what glasses are for would be concerning. Taking a moment longer to remember someone's name is normal. Not recognizing close family members would be concerning. The difference is usually quite clear when you step back from the anxiety that unnecessary testing can create. What's particularly troubling about some of these problematic tests is how they can create what psychologists call stereotype threat. When you're told you're at risk for cognitive decline, you might actually perform worse on cognitive tasks simply because you're worried about confirming negative expectations. This can create a self-fulfilling prophecy where test anxiety leads to poor performance, which leads to more testing and more anxiety. Have you ever noticed how you perform worse when someone is watching you take a test compared to when you're practicing alone? Breaking free from this cycle requires understanding that your worth and your future aren't determined by performance on cognitive tests. Your value as a person doesn't depend on memorizing 3 words or drawing a perfect clock. Your relationships, experiences, wisdom, and contributions to your community matter far more than any test score. When did we start believing that human worth could be measured by cognitive performance alone? As we near the end of our discussion, I want to emphasize that I'm not advocating for ignoring legitimate health concerns or avoiding all medical care. What I'm suggesting is that you become a more informed and thoughtful consumer of healthcare, especially when it comes to cognitive testing. Question whether proposed tests will actually improve your health or quality of life. Seek second opinions when test results seem inconsistent with your daily functioning. Focus on evidence-based interventions for brain health rather than just monitoring for problems. Remember that you have more control over your cognitive health than you might think. The choices you make about physical activity, social engagement, stress management, sleep, and nutrition have powerful effects on your brain. These lifestyle factors often have more impact on cognitive health than genetic predisposition or test results. The most empowering thing you can do is focus on what you can control, rather than worrying about what you can't. If you've made it this far in our discussion, you're clearly someone who cares about making informed decisions about your health. That's exactly the kind of critical thinking and engagement that helps maintain cognitive function. Keep asking questions, stay curious, and remember that the best test of your cognitive health is how well you're able to live the life you want to live. Don't let unnecessary testing and unfounded fears rob you of the joy and engagement that are so crucial for brain health. The most important question isn't whether you'll develop Alzheimer's disease someday, it's whether you're living fully today. Are you maintaining meaningful relationships? Are you continuing to learn and grow? Are you taking care of your physical health? Are you finding purpose and meaning in your daily activities? These are the factors that matter most for cognitive health, and they're all within your control right now. Focus on living well today, and tomorrow will take care of itself. If you've stayed with me until the very end of this video, you're exactly the kind of person who takes charge of their health decisions, and I want to hear from you. Drop a comment below telling me which of these 5 tests surprised you the most, or share your own experience with cognitive testing, whether positive or negative. Your story might help someone else make a better decision about their brain health. And if this information helped you think differently about Alzheimer's testing, please hit that like button to help other people over 60 find this crucial information. Don't forget to subscribe to the channel because I'm constantly researching and sharing the latest evidence-based information about brain health and aging. And speaking of brain health, make sure you watch the next video that's appearing on your screen right now, where I reveal the 3 simple daily habits that can reduce your Alzheimer's risk by up to 40%. You definitely don't want to miss that one.